Hello, everyone. Very good morning. And my name is Priyanka Chal. I'm an executive director of International Youth Conference. I'm also a medical doctor and a ECL Youth Ambassador, which is a European Cancer League called Ambassador at the European Union. So today, I would like to welcome you all in-person participants and also our online audience. Thank you for joining us. This is the session 12 of day 2 at OIC Edition 8, taking place in New York at AFS and live from AFS. You can also check live on YouTube, Twitter, and on our Facebook channel. So, this session is going to be very important today because this session is about the youth critical role in implementing the global public health order. And we are having our expert uh, here, Dr. Ahmad, Dr. Kniki, Khazida, and we are also having a youth advocate here, Rebecca, as well. So, as today we are embarking this crucial session centered around this very important role on implementing global public health order. So it is very important to have some insights from the experts from the ground level that how young leaders and professional and medical doctors play important role in implementing order and strengthening the health system in the ground roots and in the ground level. And it is a high time that we recognize that there must be always a space at the table for the youth, especially in the health policies and health strengthening system. So we can implement the ideas, we can execute the actions, and we can have a strategic team planning with the young minds. So today, please stay tuned with us. That's going to be a very, very interesting session. Our Dr. Ahmed is joining online, and our three experts are already here. I'll be moderating the session. Let me introduce Dr. Chris Promusiki Kaneki. I would call Dr. Kaneki. Very welcome. Thank you for joining us today.
Thank you.
Dr. Kaneki is a medical doctor by profession, and he's an Africa CDC public health analyst, PhD candidate in reproductive health sciences, and a public health practitioner. He currently works in the Office of Director General of Africa Centers for Disease Control and Prevention as a Senior Technical Officer for Strategic Programs and coordinates the Africa CDC Youth Agenda, including AU Bingwa Initiative, the annual Youth Pre-Conference, and newly appointed Africa CDC Youth Advisory Team for Health. Congratulations, Dr. Kinege. He is also a passionate social and public health-oriented professional, driven to contribute to a better and more effective social health and development policies and programs in Africa. Congratulations for these roles, and Dr. Kinege.
Thank you.
We are also having Khazida. She is a public health practitioner and chief strategy officer at Study Africa, public health consultant with a desire to improve healthcare quality and access in marginalized communities. Professional experience in health disparity research programs. So very welcome, Khazida. I would like to extend your time precious here to our audience as well. We will have a really interactive panel sessions by asking some of the questions and listening your insights from on ground as well. We are having Rebecca here. She is a board member at Africa Centers for Disease Control and Prevention, and she's also a youth advisory team for health and mental health researcher as well. We are having Dr. Ahmed online. I hope that he's able to listen us. Hello, Dr. Ahmed. He's a member of coordination team SCP Youth Platform, and he's also a member of United Nations Major Global Group of Children Youth, which we call UNMGCY. Welcome, Dr. Ahmed. I would like to provide the floor to Dr. Kni for now to share some of the insights from ground, like how you see the youth space in the global health and how you see that young professionals are contributing great in a global level where we have great discussions going on, especially in this global crisis. And we already witnessed how COVID happened and how things happen. So even after that, how you share your own experience, personal experience regarding this topic that we are going to discuss today.
Thank you, and I hope everyone can hear me because I have a problem with my voice. Online, Dr. Ahmed, can you hear me? Okay. See if Ahmed can hear me, then everyone here can hear me too. So I think to start with, we need first to understand what when you're talking about the public health order. I mean, globally, or as maybe for us in Africa or globally, what it is and what really that has like a package. Then to understand what could be the role of young people in that area as well. And as you mentioned, given what has just happened for the past 2 or 3 years with COVID-19, we come to understand that public health it's a very important area where we need everyone to be involved, because a crisis in public health is not only public health crisis, but it's also affecting all aspects of our life, economy, politics, everything is affected, because when we have the situation like what we've just experienced with COVID-19, we now understand that we need to work together as expert public health and all other experts in other area to come together to work and make sure that we're contributing all of us to the development that we need for our continent or globally. So uh, and again, I think COVID-19 has been maybe for all of us globally like a call to action, like to waking up everyone, like see what is happening, and we need to understand that coming together is no longer an option, but we need to understand that is the way to go if we need to safeguard our health on the globally. Sorry, but I'll be maybe just emphasizing a bit on Africa, but I think these are things that can be applied to globally. And what happened with COVID-19? Let me again go back to that. Seeing how the world has been affected by the pandemic, if we are not coming together as one with a general approach on how we're going to, even for now, preparing for the next pandemic, we may be facing again the same challenging, which is not good. We're not supposed to be facing the same challenging and having the same consequences that we've been having. We need now to learn that what has happened before, we need to learn from that and come up with some solution to avoid having the same problem. And I remember some months ago during the VAN conference in Bangkok, I used to listen to this thing that people say, like, okay, with COVID-19, we've learned so many lessons that we need to start implementing. But my understanding of my question at that time was like, have we really learned those lessons? If yes, what are those lessons? Because as long as we are not implementing those lessons that you said that we've learned, then it means we haven't learned anything. But if you're not implementing those lessons, it means if tomorrow we have the same situation, if another crisis is coming, or if another wave of COVID-19 coming, are we going to have the same situation, having the same loss, or are we now going to mitigate it and minimize those losses? So we need to make sure that we are learning from those lessons and implement those lessons. That's when we can say that you're learning. But if you're not implementing any lesson, that it means we haven't learned anything. So, for the contribution of young people in public health, I think for us, for example, in Africa, maybe I'll go a bit deeper, giving some example a bit later. We think that we can't, there is no initiative in public health, but not only in public health, but globally, generally, let's even talk about the SDG or the Agenda 2063 in Africa. There's not an initiative that can be successful if we are not engaging young people to be part of it. Let's look globally. What is the proportion of young people on Earth? Like now, we are talking about 8 billion, right? But what? Yeah,
1.8.
I mean, totally the population. But what is the population for young people? We know that percentage. In Africa, I'll talk about some percentage because I know about Africa. We have like 70% at least young people. So if you want to implement something that can be successful and have some impact, we need to make sure that those 70% of the population are part of the initiative from the inception, implementation, following up, and then even the M&E, and all everyone accountable to make sure that those initiatives are successful. We cannot plan for, like, I'm even looking at the room right now, we have more than 70% young people, and this is the concrete even representation. But how can we have an initiative if in this room we just speak those who are not, I mean, young people? I'm not trying to create any kind of discrimination, but we need to bring those who are the majority in the room to think together and come up with those ideas that we need to implement and make sure that the solution that we want to implement, uh, the idea came from even those who are going to benefit from them. Because if you are not bringing the young people to be part of the discussion or part of the solution that you want to have, there will still be a problem, because they'll be like, these are the things we didn't, we were not part of the discussion to really understand what they're proposing as a solution doesn't fit our purpose, doesn't fit our thoughts. So it's not, those solutions are not, I mean, are not supposed to be ours. They're just things that has been imposed to us. And as long as young people are not taking part of that process, it's just a process that is meant to fail. So, and I know so many initiatives have been failing just because young people haven't been part of it. We are talking now about SDGs. Maybe I'll stop there. Just 1 minute. But let's go back. Before the SDGs, we were talking about other things.
Millennium goals. Yeah.
Yeah. And my main question about all these initiatives, we're talking about the Agenda 2030, but before they were talking about 2015. But my main question has always been, what has been the main reason that we didn't achieve these goals, this agenda at the time as we fixed? Because the main is what we are fixing those agendas to make sure that at that time, at that date, we need to achieve, and then maybe have another agenda that we have to develop. It doesn't mean like we're talking now about 2030 and then in 2030 we just push it again 2045. No, it doesn't mean to just being postponed the thing. We need to achieve and then move to something else. But what is it that it's we are not achieving it? We keep, I mean, it's keep failing and then we just postpone. We need to look at the real reason and then come up with solution to make sure that now if you're talking about the agenda 2030, if we're talking about the SDG by 2030, we need to make sure that we are really achieving them and then move to other things instead of just talking and then waiting for the date and change. So we need to bring young people, let them to be in the action, but also holding them accountable. That's what I was telling my colleague right this morning. Yes, we've been calling for young people to have a seat on the table. Yesterday, someone made a comment. I mean, it was a bit funny, but yes, it's true. We've been pushing for having a seat on the table for young people on at decision-making table. Yet sometimes they've been giving a seat, but a seat that was very low than the table. We have to push and then even bring the seat at the same level at the table that we can speak. But again, yes, we want to sit at the table. Make sure that before going at that table, we have something to say. It's not just looking for a seat to go and sit there. We need a seat to go there and say something that is making sense. And then we are getting there. And I know so many young people globally, we are doing that. But now the thing is, after saying that we need action and then accountability for everyone, young people, politicians, government, civil society, we need everyone to hold ourselves accountable of every word that you're saying, because we need action and accountability. That's what can make sense to what we are doing. Thank you.
Thank you, Dr. Kanik. You are right that even if we need the seat, so we just don't need the seat. We need the space to speak as well. So I would say that what's words from the young people matters as well as having the seat there. So I hope that young people can contribute in that. Things are quite changing. Like if I talk about the last 5 years, and especially after COVID, so young people are getting attention, especially young health professional, I would say. So they are getting more attention in the public health as well. I myself is a global health researcher, and I mean that's what I noticed, and that's very good. And to listen to your insights from the ground and about your experience as well. Thank you so much. As we move forward, for we are having a specific limited time, so we are going to Kazira for sharing some of the insights that if you talk about any initiative that you was a part of, and how you realize that young people play an important role in this space. And also if you can give an example, like we also as this session is about health, but this theme of 8th edition is also about innovation and technology too. So could you please tell us, like, if you have an example where innovation tech is playing important role, and also youth employment, and how they can solve the public health issues, so right there with the tech.
Yeah, thank you. Thank you. First, I'm happy to be here among so many
Thank you.
wonderful young people. That's all I kept hearing. Young people, young people. So are there young people in this room? I can't hear you. Okay, let me try it again. Are there young people in this room? Yeah.
Now we got this.
Yeah, that was better. We are the present. We are the future. And that is magnified even more when you talk about health. You know, I didn't realize a couple years ago that I could enact change in my own community. I went back to my country, Sierra Leone, as an adult, and it changed my life. I realized that I could have impact in my own way. I didn't have to wait to become a doctor or to be at the end of my career to have impact. Today, we can have impact. Now, we can have impact. And I think that's the beauty of being young, that we have time and we have energy and passion to actually exercise that. So actually, I went to Sierra Leone and it opened my eyes. I thought my eyes were open, but they were like, just seeing so much possibility, so much room for growth, so much impact that could be possible. So this actually led me to look for the resources around me to see what I could do to help my community. So I would definitely encourage you all to see, what do I have around me, even if it's small, even if it's big, what can I use to help better myself and my community? So I had gone back to my college and they had a grant. It was called the Davis 100 Projects for Peace grant. Has anyone heard of that? Davis 100 Projects for Peace? Okay, if any of you are in college, make sure you look at your university, because the Davis Foundation funds a lot of projects every year. I think it's like 100. So they give them a substantive amount of money. So look into that. They look for community-based projects, and you can enact it anywhere in the world. So at the time, I was taking organic chemistry. I was miserable. And I realized after going to Sierra Leone that I could enact change, right? That I could write a proposal that could help people, help my people. So I decided to do an aid project, right? That was before I understood what I was actually supposed to do. I was like, I'm gonna get supplies, I'm gonna take it to Sierra Leone, we're gonna go to hospitals, and we're gonna, offload. Didn't get the grant that year. And I was like, why? I was so passionate. But it's not just passion that matters, it also matters how you build your proposal, And actually through this process of unlearning and learning again, I actually found my life passion, which is to develop community-based, sustainable, data-driven projects and businesses. So I realized that, hey, I had a good intention, but I need to learn how to do this correctly. So I need to have a community partner. I need to be community-based. I need to be data-driven. So I went back to the drawing board, and next year I developed, along with two of my friends, a reusable pad program, right? We know period poverty is a big deal. And I was like, you know what? I want to do reusable pad program in Sierra Leone, pair it with community discussions so that men and women can talk about these topics that aren't really talked about, right? Do we just every day talk about periods? No, even in the Western context, and we should, right? We have discussions where we're sitting down, chiefs and everyone, talking about how can we help women during their periods. Can you imagine a woman said, well, when I'm on my period, you can do the laundry for me. And I was like, yeah, that makes sense, And having this kind of conversation actually helps. And that's just developing a project, being willing to learn. Because I had to go to different mentors. And that's what drew me into this framework of being community-based, sustainable, data-driven, and things of that sort. That project ended up having so much impact. We distributed over 1,800 pads to mosque, a polio survivors community, a females prison, all kinds of places all around Freetown. And actually, it caught on. Other people started doing the pad project as well, and it's widespread. So you are the change. A very prominent young Sierra Leonean, young leader, said, "We are the ones we've been waiting for." PJ Mandewa Cole, we are the ones. So I want you to remember that. Like, don't let people say, "Oh, you're too young. Oh, you have to wait for this or that." You can do it. I actually led, during COVID, I led epidemiology investigations for daycares in Palm Beach County, right? For the whole county, I led those investigations. And I realized that people are so misinformed, right? But we can be that connection to our community and help reduce contamination, help be that difference. So I would just encourage you all to know that, hey, you can be innovative. Technology is made to increase efficiency. It doesn't necessarily mean everything has to be digital. It's like, hey, how can I make this more strategic? How can I create linkages? Because a lot of it, of project proposal, is just creating linkages. Just creating linkages. And later on, I would like to guide you all how I design projects, how I write proposals. So basically giving you a master's in public health in like 5 minutes. But yeah, you can do it. Just believe in you, find your community, partner, and be sustainable and data driven and all that stuff. But you can do it.
Great, thank you. Thank you, Hasida. That was very inspiring too, and very encouraging, and very glad to know about your work on Grassroots. And we would love to stay connected with you in the future too. And we at IYC also having impact awards, like where we ask for the impact submissions and we recognize them and we show their work on the global level, like at IYC. And we would love to have the impacts from your side too, if you can share later. So we at IYC would love to collaborate on this great specific cause with good results. So looking forward to it. Thank you for sharing your great insights here.
Thank you.
Now we are moving ahead. We are having, are we having Dr. Ahmed online? Dr. Ahmed, are you here? Let me check. So meanwhile, we are having our another panelist and speaker here, Rebecca. So I would like to ask you that as you are a youth advocate as well, so I would like to ask some questions. So as I can read in your bio too, that you are also a mental health researcher. So could you please tell me that what kind of challenges do the young people face, especially in the public and global health implementation? For example, part of some initiative, what are the challenges that you would like to address here at this space? And also, what kind of mental separation do you guys feel as being the youth health advocates? So could you please share some of the specific skills or specific examples, specific solution that you would like to share with us so we can gain more insights on this topic?
Well, thank you so much for having me. It's a privilege to be here. So looking at young people and being a young person representative, coming from Africa, and where we have a large population, about 70% of the total population in Africa being young, it's very good that we're discussing public health because these are issues that affect young people, right? Are we young here? So these are issues that affect us. Looking at mental health, looking at the pandemics, looking at sexual reproductive health, all these issues are around us and they affect all of us. And so there's so many challenges that we face as young people, but mainly looking into the public health space, we have different factors, the economical factors, social, geographical, so many issues. But then I'm going to round it up to about two issues. And so personally, I've experienced this lack of availability of healthcare when you look at funding and partnerships with young people, which is really, really critical because yes, we do the advocacy, we make a lot of noise, but then if we're not able to find partnerships and find funding, then there's so many things that we're not able to do. And so that's one of the challenges, but also looking from where I come from, the infrastructure is quite an issue because yes, we're advocating for community, but then how do we reach the people on the grassroots level? But then also I've been very, very privileged to be under Africa CDC, which Currently, we're running an initiative called the Africa Union Bingo Initiative, which involves young people between 18 and 35 years old in advocating and creating awareness about COVID-19 vaccinations. And now we're growing into different other public health issues, which is very important and very key because we are at the grassroots level. We are working with communities. And so being part of that has given me the opportunity to actually go on ground and see and realize that, okay, there's a lot that we need to do as young people. And so seeing fellow young people being actively engaged in that public health space has been amazing and great. And so those are some of the issues, challenges that we've been able to notice. But yes, as you know, if you're running an organization here or doing an initiative, I think it's very key for you to consider young people because we have the energy, we have the skills. These are areas where we're able to build skills. And so if you don't involve us, then really, I don't know what impact you're going to create. Yes.
Thank you, Rebecca, for giving some of the insights and insights about the challenges as well, especially in the field of research. If I would say that sometimes when we do some systematic review, then it's okay. But when it comes to the on-ground research in the community, then sometimes what happens, people just see the age and they see that they're having very less experience. So they are not experienced in doing the research, like the meta-analysis, let's say, on the ground in community. So yeah, that's also one of the challenges as you are a mental health researcher. So I'm sure that you face that. But I'm also sure that we young people are able to find solution in whatever condition. So we are so flexible, and even like I'm here in this panel because first reason is that I'm part of IYC. The second is also that this is very close to my heart. There are many challenges in public health. Being a medical doctor, like you see the leadership out there in the world. You see how the leaders are, taking their decisions, and there are like no young people involvement is there, especially like let's say if we talk about climate health, that's also one part, and let's say mental health, and let's say reproductive health and women's health as well. So when we see the policies are getting made in the health strengthening system, so there are always the old people who are taking decisions. I mean, we need some fresh mind, we need some fresh ideas too, right? So we need some like-minded people so they can take the actions, take the decision, they can get implemented because they are creative, they know the community, they know the people, they know how to talk in their local language. But people, let's say, who are at the top level, they are not quite aware what's happening on the local level. So it's a generational gap, and being the health professional, being in this public health field, so we can bridge the gap as well too, not just like being clinician. So Dr. Kaniki already know, like being a clinician is a different thing, right, Dr. Kaniki? And then being in the leadership, it's like when you bridging the gap between the health leaders and community health, and then you are back to the clinic practicing, and then you are back to the community. So then you realize that how the things are happening, how the dots are connecting. And when you are having, like, for example, you are having a great experience that how you implement the projects, then empathy is also playing a role, like how you connect the people and how you are researching your projects there and how you are implementing. So that this is a very great panel is going on, and I hope that after this panel we will also be able to provide some of the statement on this topic from IYC, and we look forward to it. I'd like to provide a floor to Dr. Kaniki, as due to some difficulties with joining, Dr. Ahmed will be joining us after a few minutes. Meanwhile, I would like to provide the floor again to Dr. Kniki if you want to share some more insights based on your personal experience in the same field as well, especially when we take the actions from bottom to top. How you will like to say, not just young people, I would say, but how both young and old, the generation gap, how you would like to provide any insights on this topic. Like when we implement the projects from bottom to top, like we want to implement on the bottom, we also want the global visibility and recognition. So governments, stakeholders, all of them want to know that what's happening on the ground. So please share, floor is yours.
Thank you so much for the floor again. As I mentioned at the beginning, I was trying to give first, kind of perspective at the global or continental level. Let me now a bit talk about the new public health order itself, as we're talking about the participation of young people in this vision. For the Africa CDC, because I work for the Africa CDC in the office of the director, the vision for Africa CDC in what we call the new public health order is where it says 5 pillars, just briefly. Strengthening an institution on the continent, which is like Africa CDC, the AMA, but also at national level where we are working with National Public Health Institute and but also other institutes in the continent. Making sure that you're supporting member states in reinforcing capacity when it comes to workforce development.
Yeah.
And for this, is not we're not only talking about medical doctor or nurses, but you're looking at the whole
Whole structure.
structure. We need lab, everyone in the structure at hospital. We are talking about thirdly is production of health commodity again on the continent. And yes, maybe this has been brought, shown with what happened with the COVID. Maybe I'll touch that again a bit. Production when it comes to vaccine, therapeutics, and diagnostics. And then fourth pillar is about partnership. Because as I mentioned, public health, yes, it's public health sector, but we need a partnership not only with other organizations, but also partnership between sector, because that's why we're bringing private sector into public health to make sure that as long as we can secure the health of the population, then other sector can also benefit from that. Because if we have an entire population that is sick, as for example, again, if you go back to what was happening with COVID, it was again affecting so many other areas. We have university, school, so many places closed just because we have an issue, a trade, in public health. So we need to create that partnership between public health and many other sectors to make sure that we're working together for our development. And finally, is the our local financing when it comes to national level, maybe like country level. So with this vision of the new public health order at Africa CDC, then say like what would then be the contribution of young people to make sure that this vision, as I said, is not only talking, but we need action and then result.
Yeah.
How can we then transform this vision into something that is tangible, that you can touch that, okay, this is what we wanted from the vision and it's here. And young people, we need young people to be into action. And for Africa CDC, yes, to now to go back to your question, like during COVID, you said like we need young people to be part of the response. Many people, maybe globally, they were like, when they're looking at the data on COVID-19 about the continent Africa, knowing that we used to say like Africa is that continent that's a weak public health system with all the narrative that you know. But then looking at the data about how COVID-19 was affecting globally, Africa was not that much affected. It's not that hasn't been, something that is a magical word, but it's because of what we had, like strategy in place and work with every government to make sure that even though we have that system that was not that strong, but we needed some strategy and even acted on that to make sure that we are minimizing or mitigating this on our continent. We didn't have that much access to therapeutics, vaccine, and all those things, but the strategy that we had in place helped the continent to at least trying to minimize the impact of COVID-19. And that's why we brought young people. The initiative that Rebecca just mentioned, the COVID-19 vaccination initiative, was an initiative that Africa CDC brought with other partner to champion young people to bring young people to become the champion for vaccination in their community. That's why we need to make sure that the action for young people, the contribution should start within their community. not only in this space or just online and talking about in big conference, but we needed them to make sure that we are making impact everyone in this community, and its impact in each community, that when we bringing them together can have an impact at district level, national, and then continental level. So the Bingwa initiative was to recruit, train, and deploy young people in the community to make sure that they're mobilizing people and explain to them where they need to get vaccinated. And this is why now we can have this rate of vaccination that is going up in on the continent. And at Africa CDC, yes, we have that initiative. I said, actually, we have 200 of them in East region and Southern region. I mean, the country, 10 country in East Africa and 10 or 9 country in Southern Africa, where these young people have been doing this amazing job, and you can see even from the data how we've seen the rate of vaccination going up. And again, young people, it's not only for COVID-19. When you look at the landscape of community health workers in our continent, and I'm sure in, I mean, globally as well, the the range of the age of those who are mainly at that level of supporting our system, they are young people. It's many between 18, let's say 35, and that's the category of those young people who are supporting our health system at the community level. So Africa CDC wanted to look at that capacity that we have in young people to make sure that every initiative that we may have at the continental level, but when it comes to the implementation, we need to bring young people at the local level, bringing young people in it and contribute to make sure that it's really successful. So that's how we can say today that the initiative has been successful because of the implication of young people. And that's one. The second initiative that at Africa CDC have is Rebecca again being part, and Rebecca, Franklin, and Rim who are here.
Dr.
They're
Kaneki,
part of.
excuse us. We would love to talk about the initiatives. Just by having the time constricting, it's Dr. Ahmad is
Oh,
here,
okay.
so I'm just watching him on the screen. We would love to discuss more about the initiative as well with Rebecca as well. We will collaborate about the implementation of that, and we'll love to ask some of your suggestions, like how even our ambassadors at RYC can be a part of them, and even if they are interested more in health. And because our focus is more on the global south countries, we have a lot of ambassadors from countries, and we keep receiving their texts like how they can be a volunteer in the health organizations too. So we would love to ask more details from your initiatives, from your experience, and from what Rebecca is doing, and from Kazida as well. So as the time is limited, I'd like to provide floor to Dr. Ahmad Hawla. Dr. Ahmad, are you able to hear us?
Yes,
Thank you. Very welcome. Thank you for joining us again. I'm sure that technical problem happens always in these conferences. So, Dr. Ahmad, I'd like to ask you a question: that in what ways can intergenerations collaboration be promoted to ensure the wisdom of older generations complements the energy and innovation of youth in public health endeavors? And please feel free to share your insights and remarks on this topic and international organizational collaboration in this public health field. As already Dr. Kaneki also shared us some of the insights on this topic too, we would love to hear from you as well. Floor is yours.
okay, thank you.
Thank you.
Hello,
Hello,
everyone.
everyone.
Good
Good
morning,
morning,
ladies and
ladies and
gentlemen,
gentlemen,
distinguished
distinguished
guests,
guests,
and
and
fellow
fellow
participants. My
participants.
name
My
is
name
Dr.
is Dr.
Ahmed
Ahmed
Awada.
Awada.
I am the
I am the
former
former
contact
contact
point of
of
Health
Health
Working Group
Working Group
at
at
Yango.
Yango.
I am
I am
serving as
serving as
external
external
relations
relations
of
of
Act for
Act for
Sustainable,
Sustainable,
which is
which
one
is
of the
one of the
youth
youth
lead
lead
initiatives
initiatives
in
in
Egypt that
Egypt that
focusing on
focusing on
climate
climate
change and
change and
increasing the
increasing the
awareness in the
awareness in
local
the local
community
community
and
and
in
in
Egypt and
Egypt, and
also
also
across
across
the
the
region
region,
in the
in
MENA
the
region.
MENA region.
I am
I
honored
am
to address to you today. Can you hear me? Okay. Okay. Thank you. I am honored to address to you today on the critical role that youth can play into the implementing the global public health order. Our world faces a complex health challenges from pandemics to non-communicable diseases, and the active involvement of the youth paramount in addressing these issues. In my intervention today, I will highlight the significance of youth engagement and propose strategies to harness their potential for healthier global community. First of all, the youth-led initiatives. Youth-led initiatives is one of the essential demands that we always keep asking for it. We need to have the support from the governments, from the UN agencies, from all the stakeholders across the country, also like across the region and the globe. These initiatives and engaging the youth in the national process. This is also one of the most important demands that we always keep asking for it. Second, a digital health platform. Leverage the technology to engage youth in health promotion, developing online platforms, social media campaigns that can educate and inform, and also connecting the young people to public health initiatives. Third, policy involvement. Facilitate and support the youth participation in the policy development and the decision-making process, such as such as establishing the youth advisory group or a youth or the youth advisory councils to ensure their voices to be heard in shaping the local, national, and international health policies. Recognizing the youth in the national policies is one of the important, because without any recognition from the government, they are not recognizing the youth role. So we are not will be in their agenda. Fourth, investing in equality, health, education, and training programs that actually empower the youth with the knowledge and the skills to become health campaign like healthy champions and or the youth health ambassadors. Like uh, uh, just I would like to highlight that the initiative of the like Bianca, she is belongs to that make her ambassador. So these actually like these initiatives and these plans that we needed to be increased across the globe. In the end, the youth represent the powerful force into the implementing the global public health order. Their energy, their passion are essential to our collective effort to build healthier society and healthier communities. By investing in their education, supporting their initiative, and also involving them in the policy making, we can unlock the full potential of the youth as change the agents in the world of the public health. Together, we can create the healthier and the resilience global community. Thank you, and over to you.
Leaders. Thank you so much, Dr. Ahmad. We are very honored to have you as well. And we look forward to have more future collaborations and interventions with you in person and online as well. Thank you so much for joining us. So now I'd like to ask our audience if anybody is having any questions to ask from our expert panelists here. So feel free to ask any question, and I would like to say same to our online audience as well if they are having any questions and comments. So please feel free to use the comment box. We are having yes, please.
Uh, this question should be specifically directed to you and not a person who may want to answer it. We have experienced devastating loss of lives and properties and kind of a whole shutdown of things during the COVID-19 pandemic. It was really unfortunate. So my question is, what is WHO doing at this present moment or right now to ensure that we don't go into another pandemic? Because it's like building things for so many years, and when the pandemic comes, it's like messing up everything again. So we have to start all over. So where are we getting to where we are headed? It's going to take a long time. So what are the strategies, or what is the WHO exactly doing right now to ensure that we don't, get into another funny situation like that? Because 2 years ago, none of us was here. Like 2019, 2020, basically 2021. We are all closed. Nobody's going out anywhere. And that was really unfortunate.
Thank you for your question. Actually, that is a very interesting and very complicated questions. I mean, it need to be answered. We all agree, but unfortunately, right now we are not having any speaker from World Health Organizations, and I'm not sure that we are able to answer this question. But we would like to extend this question and on the for Dr. Kniki, but only from the African point of view from CDC. So I'd like to ask Dr. Kniki to take the floor and please share your remarks on this question based on your African region and CDC point of view. Thank you.
Thank you, Priya. Sorry, my friend, can you remind the name again?
I'm Ali
Ali.
from Gambia.
The Gambia.
Right.
Okay. I know some of you prefer to say the Gambia than Gambia, so I want to make sure if it's the Gambia or Gambia. Anyway, thank you for the question. And I think just maybe to emphasize that that is not only a task for the WHO itself, and as our model said again, I'm not responding like on behalf of the WHO, but maybe on as Africa CDC. But again, I know just actually, I mean, yesterday there was a meeting for those who are following the discussion at the General Assembly. Uh, and I appreciate the question because we as population, we need to know exactly what is going on and what is being so that because all the discussion that even they're having there is not only for them, it's something that are going to impact our lives. So we need to know, and I appreciate the question. We actually are talking about the PPPR. You can just try to Google and get all the information. Pandemic Preparedness, Prevention, Response. This has been the discussion has started and the declaration has just been made yesterday, 2 days ago, or yesterday when they finalized it. To how, as I mean, global, we are going to respond to the next pandemic because we've seen what COVID-19 has done to us. I mean, everyone, not only here in America, Africa, everywhere. We need now to come together global and then like what can be the response for how to be prepared for the next pandemic. Because the question is not if there will be a next pandemic, because to that question the answer is yes. The when, that's what we don't know, but we need to start preparing now so that when the next one is coming, it may come after a year, it may come after 10 years, or even if it is coming after 50 years. We need to start preparing our system now in place to avoid that the same situation that happened, as we mentioned 2 years ago, we shouldn't be going through the same problem, like having the same laws, having the same situation where we're closing school, closing university places just because of the pandemic. We need to have a system in place where we know that we can be able to detect a virus at the beginning and make sure that we can come up with vaccine or medicine to stop the involvement of the situation instead of just waking up, I think, after a month and then the virus has contaminated the whole, the whole world. So that pandemic preparedness response, declaration that has just been made yesterday, and I'm calling everyone to really try to Google and find what the declaration it's, and then you can have those information in detail. But the idea behind all the treaty is to make sure that we are actually preparing ourselves, not only as I mentioned for talking about Africa, CDC of Africa, but it's a pandemic, a treaty that is bringing together all the public health institutions. We have Africa CDC in the WHO that is represented all over the world. We have so many other organizations coming in together and discussing with this treaty that is, a declaration that is allowing us to prepare for the next pandemic. So it's not only, as maybe to answer your question, a responsibility of WHO as an organization, but our government, again, they're coming in there to give the position, also giving their point of view on how we are going, because this can be a declaration here in New York, but the implementation should, again, as we say, go back home at the community level, start implementing this system. When we're talking about strengthening our public health system, this should start at the community level. When we go in our village, country, we need even to go back in our village, those remote areas, to make sure that at that level we have a system in place where when there's something, a knowledge somewhere, we can be able to pick it and then respond to it. Because if you look at all the time when it's we're talking about outbreak or pandemic, it's something that may start very far in a village. Let's take an example of Ebola. So, just a minute. When you're talking about Ebola, we're talking about many Africa, and for example, maybe if we go again a bit in detail, in DRC, but it's not in the capital city that that thing started. It's just going like in a village somewhere where someone is going to get it, and then it starts to spread. So, if we have a system in place in that village that can be able to contain any threat at that level, we are making sure that it won't get to the city, it won't get out of the country and then contaminate everywhere. So that plan is to make sure that the system that we want to have in place is to have that system alert at the very basic level, everywhere, not only in one place but everywhere, so that we can be able to detect those situation and respond to them very quickly, and have the situation under control. So if you are not doing it and keep discussing at this continental level, talking about what you have to do, but and again, people in the village, they don't know that here we are, even here now in this room discussing public health, but then they are there doing their own business. We're not telling them how they need to be, because the thing again is to even go down there to very break down, because when we're talking about virus, it's how we're interacting with animals in the village. We need to go and tell people that, like, this is how we need to interact. You need to eat this kind of animal, but we need maybe to make sure that how we are cooking the thing. So those are also some very much detail that, again, that declaration I'm talking about is talking about, but we need the implementation at very much level,
Right.
to make sure that we are making it. Because if we're not doing that, then we still have the same problem.
Absolutely. I think we all agree on this great answer that, and I think first, if we talk about WHO, then it's always good to do some of the research by own, like how the things are happening and how, even in terms of vaccination, because even about COVID, virus, they mutate very fast. So even they have the problem, like the experts, vaccination building experts, they have the problem to read all of the genes, to count all of the genes. So that's, but but public health awareness is very important. I would say the education and awareness is very important to educate the people about everything that what the global health agencies are doing. So I would say that newsletters, newspapers, media, and all of the people on the ground and even on the global levels, when they do collaboration, the awareness must be there, and that plays great role in like how the things are working and how we need more solutions and how we need a collaborative preparedness together to solve these global health issues. So with the final notes, I would like to provide the floor with Kasida. If you have any final interventions to share with us, we would love to hear, because we love your energy and we would love to hear more of your experience as well. So please share us your final call for the youth and in the health as well, for the public health sector.
Yeah, thanks. Awesome. I actually want everyone to know that, like, not to be afraid, right? Don't be afraid to get dirty. Like, literally, last year, I was literally in the gutter in Sierra Leone, in the largest gutter in our country, the largest slum community called Krube. And it's because that was my public health solution, right? I had done research before that was trying to figure out what was the major barrier to health for women in this community. I did the research because the research didn't exist. So don't be afraid to go out there and create the research, because for a lot of marginalized communities, they're not being researched. So I got the research because we need to be evidence based, and they said, hey, flooding is actually the biggest barrier to health for women. 98% of women that we surveyed. So like, okay, I want to do a flood project. I want to mitigate. And most women said that the reason that flooding was happening was because the drainages were blocked. So we hired 9 community members to help us unblock those gutters. So that's how I spent my summer. And that's a public health solution. So public health solutions aren't only in the hospital. We've talked about intersectionality, right? Like we have to open our mind and be more innovative, as you mentioned. Like, and those kind of solutions have big impact. You know, we actually tested the water before we did that intervention. We had like 100 times the WHO standard lead contamination. And these are areas that people were drinking from. We surveyed 10 spots, all contaminated. After our project, there was no contamination in those areas that we retested. And that's a public health solution. So don't be afraid to get dirty. And honestly, people did not understand. They're like, you're leaving America, you're leaving New York City to go in the gutter, right? And
Mindset.
yeah, and I want you all to find what your gutter is, like what drives you, because at the end of the day, it's going to be hard. And one way or another, there's going to be challenges because when you're implementing, you need to be adaptable. So what's your gutter? What can you do that will drive you, that you have a passion for? And not everyone has to understand. You know what I mean?
Yeah.
Like there's people who think you're crazy, but it was your idea.
But you know that you are crazy.
A little bit,
Yeah.
or you're crazy passionate.
But
so
crazy people always provide the solutions, and it's the craziness that also lead us. That's kind of a motivation, but people call it craziness.
right, like airplanes.
Yeah.
I wonder how they explain that one. So yeah, don't be afraid to get dirty. So that's what I want you all to think and have hope. Sometimes it can be discouraging. Being a leader, thinking outside of the box. There's gonna be people that don't agree with you or are gonna say you can't do it. Like my aunt was like, Khadija, you need to go back to America and get a real job. And I was like, Auntie, I wrote a grant and I'm doing this project, but thank you. We take all of those different suggestions and we come up with our own solution. It's good to hear those different inputs because it gives you a sense of reality, but you're not crazy. You just dream big. And that's okay. Like we need to dream big. So dream big, get dirty, and don't be afraid to do the work.
Great, thank you. We all are taking notes, and I hope that in-person participants are also taking the notes in mind or on the notebook, I would say notepad. And thank you so much, our great speakers and panelists here that are all the experts in their field. Dr. Hamad already left us, he was having another meeting. And thank you so much. I think we had to wrap the session as we already passed almost 1 hour of the session. Thank you so much, our online audience, for joining us today. And I hope that you enjoyed the session, and I hope that you will take more notes and more inspiration from our great speakers here. And I would also like to say again, thanks to our in-person. We still have many interesting panels coming on. And we are about to end our live now. If my colleague can help me to end the live, it would be appreciated if I can see somebody here. Meanwhile, if we have 2 minutes, if anybody is having any question, then feel free to ask. Yes, please.
Hi. My question is more directed towards how to start. So I come from Colombia, and public health is a very big deal, and we don't have funding. We don't have the opportunity to go and start a project out of the blue. And I was wondering, how did you guys actually the ideas you had and the problems that you saw, you made it actual?
Thank you. I wanted that question. So let's get our MPH real quick, our Khadija MPH. So first, you want to look at the breadth of the issue, right? See what's the magnitude. Even if it's something of interest to you, you need to know, is this a problem for the people? Even if it's a big problem. And if it is a problem for the people, how big of a problem is it? So first, identify the breadth. So that's going to be research. That's going to be talking to people on the ground. That's going to be doing scholarly research. That's what's it called, Google Scholar, no promo, but different databases and learn about the issue. And that's where that intersectionality comes in. You'll learn about the historical, economic, social factors. So once you've done that, then you're gonna have to target a population. And I mean like get really specific. So this is MPH. I'm giving y'all some goodies right here, some NYU goodies. So after you've gotten your topic and it's justified, you go to your target population. This has to be so pointed because this is like how you're going to design your intervention. So what's the gender, right? If there's a specific gender, what's the age group? Is it 18 to 25 or 50 to 70? Those are two different age groups that have different needs. Where are they located? Like me, right? I did Freetown, Sierra Leone, but where in Freetown? Like specifically, like if you can get the street kind of a thing. So mine is crew-based slums, because that's a specific area. So once you've done that, you have to connect the problem to the people. So it's all about linkages. Proposals are just linkages. So how do these two connect, and how can I improve that connection? So for mine, I was like, okay, I did the research. They said that there's flooding. We need to, they said that it's blocked, right? And this blockage is affecting women. So what can we do? We can get the people to literally shovel out the trash and link that trash to the dump site. So we had a linkage system of how we're going to take it out and dispose of it. So after you've kind of developed that project, you have to do it alongside community stakeholders. We're nothing without our community, to be honest. We have to talk to them. How can we solve this? And even propose to them what you think. Just take a pass at it and then tell them, and they'll tell you how to improve it because that's their lived experience. After you've done that, you're going to write it. You're going to go back to the drawing board, write it out, and then you're going to look at it as if you didn't write it, as if it was somebody else's, and think, what are all the problems with this solution? Like, what's everything that if I gave it to like some random person that could give me like a bunch of money, all the money I wanted to fund this project, what would they say? Then you go back and you fix your proposal based on those questions that you asked. And then once you fix that proposal, you have a really good intervention, propose it back to the community. That's how you do it. So I know that's a lot, but that's literally how you do it. And that's how I've won several grants. So if you have questions on that, let me know. I'd be happy to read your grants if you write it. But that's literally the process. And then there's like, having support, being adaptable. It's never going to go how you wrote on paper. Never. So just expect it. What matters is how you respond to the challenge, if that makes sense. So that's the gist of it. I hope I answered your questions.
Thank you, Kasida, for answering. We are already out of time, but that was a great questions. And for moderation, we request our colleague to end the live now, as our speakers for the next panels are waiting. And thank you so much for joining us today. Thank you, everybody. Please stay tuned for our next panel. Thank you.